Let's begin. So welcome to this final seminar for the year for the Campbell Center for the Study of Animal Welfare. And we are really fortunate today to have with us Dr. Anna. Oops, is
I
it?
think my video needs to be on too.
Okay.
Sorry.
Okay. We're really fortunate to have Dr. Anastasia Stellato with us. Anastasia is returning here to Guelph, has been here for the past couple of days, coming to us from Texas Tech University. Anastasia did her MSc here at Guelph in OVC with Dr. Lee Neal in 2015. She did an MSc by coursework, and her aptitude for research was such that she eventually went on to do a PhD here, finishing that in 2019. Then, after a short postdoctoral fellowship here, she was swept up by Texas Tech University, where she is currently an assistant professor in the Department of Animal and Food Sciences there. And she is a certified applied animal behaviorist now, and she directs the human-animal interactions lab at Texas Tech. And her approach, as you can see from the title, is using, she actually uses mixed methods and epidemiological approaches within the context of One Welfare to study topics like animal handling and enrichment. And so with that, I will we'll hand the floor over to Anastasia for her talk, which is titled today, A One Welfare Perspective on Veterinary Handling, Examining Relationships Between Handling Practices, Veterinary Well-Being, and Dog and Owner Experiences. Anastasia, so glad to have you back.
Thank you. Thank you, Derek, for that introduction. So yes, I'm so happy to be back and be in familiar space. Took many seminars in this class, so it's great to be back here. So I'm going to be talking to you about my research. I'll talk about a little bit of projects from my lab that my students led, looking at relationships between handling approaches, including both the vet, the client, as well as the dog. And so, oops. Yeah. So just to frame the scene a little bit, we know that veterinary clinics are a source of stress. We know across research studies that dogs, about 10 to 78% of dogs have shown some sort of levels of fear or fear displays. And we know that this occurs from the moment they enter the veterinary clinic, so the waiting room, to even being weighed on a scale, and of course, during that physical examination. We also know that dog fear is associated with a range of stimuli and environmental responses from their exposures during their clinic visit. So we know fear is elicited from novel and aversive stimuli such as unfamiliar people, unfamiliar noises and sounds, as well as any painful or negative experiences. The location of the examination itself. So this includes whether they're on the ground or on a table and whether or not there's traction surface, as well as the presence of familiar caretakers. So there is research that suggests that having someone familiar to the dog, such as their owner, actually can work as like a stress buffer, and also the handling that they're exposed to. So the physical handling during that procedure can impact the level of fear being displayed. We also know that fear can escalate to aggression. So this can either happen in the moment during an actual appointment, or it can happen over time. So if they have a negative experience in one visit, that might create some more negative responses in that future visit as well, leading to more safety risks, impacting the ability to complete a full physical examination, and also impacting client compliance. So there is research that says that dog owners are basically less likely to go to the vet clinic if their dog is experiencing such stress. Hence the introduction of stress-reducing practices. So these have emerged in response to these issues. And there's a range of initiatives that have existed or do exist to this day. So the first one I'm highlighting here is Dr. Sophia Yane's Low Stress Handling book and text. So I'll be referring to this text actually throughout a series of some projects that I'll be reporting on. It basically gives some guidelines as to how to physically examine an animal depending on their behavior and their response to some physical restraint techniques. as well as we have fear-free. So fear-free involves basically continued education of sorts, where you do some series of learning and you can become certified in using these practices. And you can also certify a clinic itself to be holistically fear-free certified. We also have Karen Pryor's veterinary visits, and then Dr. Sophia Yin's website is now called Cattle Dog Publishing, and they have basically other certifications in place for you to say that you've done the job, you've learned the things, and you know how to apply these principles. And the principles, besides the physical handling aspect, also involve different recommendations to make the visit just more pleasant. So this involves providing treats throughout the examination appointment as a way of distraction, as well as kind of changing their emotional state in the moment, as well as allowing time for acclimation. So rather than jumping in and doing the examination right away, it's a matter of letting them get comfortable with the examination room, letting them get used to different types of stimuli at once before proceeding to that physical restraint or physical examination. We also have performing the exam wherever is comfortable. So that could be on the owner's lap, on the ground, or on a table, again, wherever is comfortable for that animal. And then chemical restraint. So this is usually in response to displays of fear or aggression. We can either have it on file or make decisions on the spot regarding whether or not we need to administer trazodone or gabapentin or something to help reduce those arousal levels to facilitate an easier examination. And then, of course, we have these low stress handling techniques. So the principle behind low stress handling, or these stress reducing handling principles, is basically using the least restraint needed, and not basically muzzling every dog we see or providing full body restraint for every dog we see, but making decisions guided by the dog's behavior. And so this usually involves a 2 to 3 second rule, where we either make a change in our actual handling after 2 to 3 seconds of struggling, or 2 to 3 different attempts. And so handling exposure in the clinic varies from very minimal or the least restrictive. So here we have what's called passive or minimal restraint, where the dog is basically not really being touched. Someone is basically administering something in the back end, and someone is quite lovely giving some treats as a distraction during that procedure. So that would be the less restrictive handling. And then the other end of the spectrum is what we would call like a full body restraint, which involves little to no movement being permitted. So we see two handlers here having the dog in a lateral recumbency. The dog is really not able to even move their head. At the most, maybe they can like lip lick or vocalize or move their ears, but that's really all that's permitted in this physical restraint. And we know across the animal kingdom that high levels of physical restraint elicits increased arousal and feelings of negative affect. And so we do want to make recommendations to lean more towards the lower end of restriction to allow these more positive animal welfare experiences and outcomes in clinic visits. However, the complexity of improving veterinary patient interaction is quite complex, given that we have multiple perspectives and multiple stakeholders at play here. So we have the animal patient that comes in with their own feelings, their own previous experiences, and they're there due to decisions made by their pet owner. Their pet owner is coming in with their own preferences, their own expectations, their own feelings of nervousness or what have you about bringing their animal there for whatever reason they're bringing their animal. And then we have the veterinary staff, who are basically tasked with balancing the needs of the animal and the client, while also trying to uphold their responsibility of maintaining and promoting the health of their patients, while also trying to safeguard their safety at the same time. And so this does call for a one welfare framework, where we integrate the needs and the perceptions of all of these three stakeholders combined. We know that the veterinary visit is basically fundamental involving the relationship between all of these three stakeholders together. And low stress handling, or these stress reducing principles, are positioned in such a way that there can be beneficial to all three, such that if you improve one of these elements, that we should be able to improve all. So it should be acting like that rising tide that could be raising all of these ships. There is some research that says that low stress handling is beneficial to reduce dog fear and stress levels. that it could reduce animal-related injuries for our vet staff, as well as increasing owner compliance, increasing their satisfaction level with the appointment, as well as increasing that clinic attendance. And then the clinic environment is basically shaping these relationships through having flexible appointment times, the physical environment itself, so what type of noise levels, flooring, et cetera, like the physical structure, as well as what type of exam protocols are in place, as well as what type of staff training that is involved there. And so I'm going to now go over some research that goes through each of these three stakeholders, examining the relationship that they across handling and their perceptions around that during a routine examination. And so starting off with dog patient welfare, we really first wanted to know just how do dogs feel during exposure to these types of restraints during a routine examination. And so the research that I'm going to present here is from, she's now my PhD student, but this is her master's research that she did in my lab, Alyssa Cisneros. She recruited 100 dogs from a local animal shelter, and she randomly allocated each dog to one of 5 treatment groups. So each treatment group had about 20 dogs, and the restraint techniques that we used were from Dr. Sophia Yin's low stress handling book. And it ranged from the least restriction, so passive, to the most restriction, that full body restraint. And then we had 3 types of muzzles that we chose. So we chose a basket muzzle, a soft muzzle, and then a manual muzzle hold. Each dog had this physical restraint applied to them for a 2-minute physical examination, where another handler was performing physiological assessments such as temperature, heart rate, and respiratory rate. Then after that 2 minutes, all dogs had either hands removed or the tool was removed, and then we observed their behavior 30 seconds post-handling. So we basically recorded everything. We scored behaviors on Notice Observer, and the behaviors that were used were previously used behaviors from different research looking at fear behaviors during clinical examination. So lip licking, body shaking, reduced posture, yawning, escape avoidance, and vocalizing. All of these were individually scored across all treatments. And then we also compared the differences in temperature, heart rate, and respiratory rate across the treatments as well. And given the fact that some restraints are highly restrictive and prevents some behaviors from naturally being displayed, we wanted to make sure we had some sort of comprehensive assessment of fear across these treatment groups. So we also used a fear score that was previously used in research as well within this setting, with 0 being no fear, 4 being the highest fear, and 1, 2, and 3 being mild to moderate. And these fear scores were dictated by posture and other subtle behaviors as well. Okay, so just diving into the descriptives of what we found regarding these fear scores. So they're ranging from the lowest fear score to the greatest, and it is relatively in line with what we hypothesized in regarding to higher restriction leading to or having more fear. So we see passive restraint having the lowest fear scores, full body the most, and then the muzzle somewhere in between. The basket muzzles were associated with the lowest fear score, soft muzzle the highest, and interestingly, the muzzle hold was in the middle. We did believe that maybe that would be potentially more aversive, but we see here some differences in that. Descriptively, we see that soft muzzle had that higher fear score. Looking at the data, we actually see that the fear scores for passive restraint was significantly lower than every other treatment group. So not much difference between, but we see that passive restraint is being perceived potentially here as the least aversive because they were associated with that lower score in comparison to all the others. You can see there's actually no difference in fear scores post-handling. So that orange bar or that peach bar, they're all the same relatively statistically. However, we see a significant drop. So after all of the handling was removed or the tools were removed, those fear scores dropped significantly, suggesting that whatever fear we were observing was actually in response to that handling during that physical restraint or during that physical examination. Looking at the individual behaviors, we see proportion of vocalization on the y-axis and the x-axis having the treatment groups. We see those that were exposed to full body restraint were vocalizing more in comparison to those exposed to a passive restraint. And so this is suggesting that dogs were potentially in a higher state of potential distress, and were being perceived as more negative in comparison to that lower level passive. And then for escape attempts, so this is not attempts, successful escapes. This is actually removing their body from that physical restraint or getting that tool off of them. And we see a lot more of escape during the muzzle hold application in comparison to passive. So we had a lot of head aversion, head shyness, a lot of wiggling during that. And so this is potentially suggestive again that that is perceived as more aversive due to that. But I am cautious to say that just because full body restraint doesn't have a significant difference from passive, that means it's not negative. We think that the restraint here was just doing its job. They can't move, they can't escape. That is the reason why why full body restraint is performed, so that they cannot move or escape. And so that is the reason that we believe that we are seeing that type of result here. So the take home here is that we do see associations with negative responses and restrictive handling. Anecdotally, 3 of our dogs had to be removed from our sample due to displays of aggression. So this was included growling and whale eye. And these dogs were only those that had the full body restraint applied to them. I know it's only 3 dogs, but that to us was more meaningful than if it was in any other treatment group, because it's suggestive that the more restraint that is applied is increasing those arousal levels and increasing those negative responses. And so the recommendations that we can make based off of our data is to encourage the use of passive restraints, to discourage the use of full body restraint as well as muzzle holds. And muzzles, of course, should be used if necessary to promote safety. However, we want to promote the use of basket muzzles over soft muzzles and muzzle holds, of course. And then again, with everything, individualized care. So making sure that we make decisions based off of the animal's current behavior, any animal behavioral history we have based off previous visits, and of course, owner preferences. And so leading into that, we now want to look at the owner perspective. How do they feel when their dogs have different techniques applied to them during routine care? And what perceptions do they have and preferences do they have regarding veterinary patient or their interactions with their dog with the veterinarian during these routine examinations? And so the study that I'm going to be sharing with you today was conducted by Amber Carroll. She was an undergraduate student at the time in her senior year. She has now since graduated from a master's program at the University of Edinburgh. And so for this research project, she completed an online survey that asked pet owners how they felt about 13 different handling techniques and how the application of those techniques, whether or not they agreed with them or not, from a range of strongly agree to strongly disagree. The 13 handling techniques were selected from, again, that Dr. Sophia in textbook. They ranged from passive to full body to different types of head restraints, application of Elizabethan collars, dog masks, and a wide range of tools. We also asked them to report on their perception or agreement with the use of these techniques for if their dog was calm, fearful, and aggressive. And so, of course, we gave them written descriptions as well as images for each technique. And we also gave them descriptions of the dog behavioral definitions of what calm, fearful, and aggressive meant. And then we wanted to look at risk factors for what influenced their perceptions. Particularly, we wanted to look at the 2 ends of the spectrum. So risk factors for their agreement with minimal and risk factors for their agreement with full body. And we looked at factors such as their pet attachment using the Lexington attachment to pet scale, as well as owner demographics such as their age, their experience with pet ownership, as well as whether or not they had a current or previous veterinary experience or work experience. So we were able to collect that's covered. It's about 1,176 individuals, so about 1,200 dog owners. majority of which were female from the United States, and about just over half had some sort of veterinary work experience. No, you're good. So looking at their preferences for, again, just descriptively, for certain restraint techniques, we see that regardless of dog demeanor, thank you. Regardless of dog demeanor, so whether it was their dog was calm, fearful, or aggressive, there was general disagreement with the application of full body restraint, laying full body restraint, so whether it was sternal or lateral accumbency, muzzle hold, so that manual physical hold of the muzzle, as well as a dog mask. Side note, my student drew all of these. Excellent use of her other skills, and it was a way to obviously unbias the owners in terms of how the animal was looking and feeling during these techniques. So we see these statistics here that are being reported are averages across the dog demeanor because there was no seeming difference. However, we do see owner agreement with the application of muzzles, particularly if their dog was displaying aggressive behavior. And so we saw soft muzzle and basket muzzle having high agreements, with soft muzzle actually having slightly more compared to that basket muzzle. So looking at those two ends of the spectrum, looking at minimal restraint and full body restraint, we see that typically owners had pretty good agreement with the application of minimal restraint if their dog was calm and fearful. However, we see a drop in their agreement if their dog is aggressive. And then we see the opposite being true for full body, where there's more likely to agree with with the application of full body restraint if their dog is or was displaying aggressive behaviors. We think maybe there's a safety concern here where they're just more likely to agree with their dog needing to be controlled a little bit more in their movement to safeguard handling risk and such. But that was just our hypothesis. Regarding their preferences for veterinary interactions, about half wanted to be there in the clinic, in the appointment. They did not want their dog to be taken away. They didn't want to be removed from the room. And so this is nicely aligning with current research suggesting that it could act as some sort of stress buffer for them. And about 82% preferred their veterinarian spend time with them. So this kind of speaks to that acclimating with the room prior to going into that veterinary appointment. So again, nicely aligning with current recommendations. Regarding pet attachment, this was relatively not surprising, but the higher attachment score they had, they were more likely to agree with minimal restraint if their dog was displaying fear. However, if they reported having a previous or current veterinary experience, they were more likely to agree with the application of full body restraint if their dog was displaying fear. And so this was very interesting. And so we think this is capturing the different perspectives of why certain handling techniques may be applied. And so unfortunately, it is relatively in contrast with the low stress handling approach, where it is suggested that the use of restrictive techniques is again not recommended, as it is more likely to increase fear and thus the potential for aggression. And so it makes sense that there might be that perception, but we still need to look into a little bit more about why these handling decisions are being made and what factors might be influencing them in that moment. And so that leads to our next stakeholder, the veterinary staff, and looking at their experience as well as looking at their well-being. And so for this next piece of research, I'm going to be speaking to my current PhD students' PhD research. Her name is Lindsay Nakaneshny. She did an excellent job diving through the nuances of all of this data, and she's also a CISA alum. So she wanted to look at the different handling techniques basically that are being applied. So what is actually being done in practice? We don't really know. So we wanted to assess that. We also wanted to know, again, looking at the factors that influence their handling, so doing some risk factor analysis there, as well as trying to tease apart that relationship between handling decisions as well as well-being. And so the first study that I'll speak on was an online survey. It was targeted to veterinary technicians, veterinarians, as well as veterinary assistants across both the US and Canada. And she used the same 13 handling techniques from that owner survey. So we wanted to now ask the frequency of using these from a scale of always, often, sometimes, and never. Again, we gave the same descriptions and the same images. And we also asked them to report on the frequency of using these techniques if the dog was calm, fearful, or aggressive, to see whether or not that behavior is shaping their decisions or influencing the frequency of the using of these techniques. And then again, we wanted to look at risk factors. So what's actually influencing the decisions, and to hone in on two of them, we used the minimal and full body restraint as our outcomes for our regression analyses. And the predictors were looking at demographics. So again, their age, their gender, the year of graduating from their program, as well as exam-related factors. So this could be, do they have a stress-reducing certification such as fear-free? Have they ever been bit? What type of practice do they work at? And we also asked them what type of factors might be influencing their decisions on a scale of strongly agree to strongly disagree, such as the owner's presence, completing the examination on time, completing all components. And then we asked them to rank different elements from most to least important regarding whether or not these factors are worthy of consideration or important to consider during an appointment. And these factors included completing an appointment in time, client satisfaction, staff safety, minimizing the stress for the patient, and then completing all those components. So they had to rank each of those elements from 1 to 5. We also asked them questions about professional quality of life, and I'll speak to that separately in a little bit. But we did want to get a more holistic lens of all the different factors that could come into play during practice. So a snapshot of what the population looked like. So we achieved a sample of 671 responses. Vast majority had some sort of certification, so that low stress handling, either fear-free or whichever certification, majority of which were female, were a vet technician, graduated from 2015 to 2023, were from the United States, and also worked at a small animal clinic. So just to hone in on these 2 restraints, rather than going over all 13 for the sake of time, I'm going to talk about some trends that we see in the frequency of using minimal and full body restraint. So we have the number of responses on the y-axis, and we have the behavior dog demeanors on the x-axis. And we see across the board, across dog demeanors, they're relatively all used. There's common usage across all. However, for minimal restraint, we see that the frequency does decrease as the demeanor changes from calm, fearful to aggressive, with the lowest, with less minimal restraint being applied if the dog was aggressive compared to calm. And then again, the opposite being true for full body restraint. We see an increasing amount of reporting of using this type of technique if the dog is displaying aggressive behaviors. And so going into that ranking question, so we have the proportion of responses on that x-axis and all of the items that we asked there on that y, and we see that staff safety came up as the most prioritized item. And this is kind of in line with what we believe is happening here, that's seeing that change and increasing the use of full body restraint when a dog is aggressive. If safety is being prioritized, it is in line with the fact that they would want to control the dog's movement as much as possible to feel like they could safely handle that animal. So going into our risk factor analysis, when we looked at factors associated with using minimal restraint, so all of these are associated with increase in use, we see that if they had some sort of stress-reducing certification, such as fear-free, or they provided treats during the examination, they were more likely to apply minimal restraint. And so this is good. It aligns with what we suggest. It aligns with current recommendations. Now, looking at factors associated with full body restraint is a little bit different, more little nuances here, as it seems that different priorities and context come into play with the application of this type of restraint. And so if they said that the owner presence influences them at all, they were more likely to apply full body restraint. Also, if they were not a veterinarian compared to a veterinarian, they were also more likely, and this probably just speaks to roles and responsibilities. Oftentimes the techs do a lot of the actual restraint and that aspect as well. And so interestingly here in the next item is if they had lower prioritization. So if they ranked staff safety as low compared to number 1, they were more likely to use full body restraint. And so this is very interesting because this is great. It aligns with the recommendations of not applying more restriction to not increase those arousal levels, but it doesn't align with the descriptive data that we're seeing. So we really need to tease this out a little bit more and try to figure out how staff safety is playing a role and in what way is it influencing or does it change per staff member. Then we also saw time. So the actual amount of time allotted in the appointment, as well as making sure they complete all of those examination components. If those were perceived as influential or important, they were more likely to apply this high level of physical restraint. And so last but not least, bite history. And I have an asterisk there because this one was associated with lower odds. So if they had a bite history, then they were less likely to apply this full body restraint. And so this suggests that previous experiences is basically shaping these decision-making processes. Okay, now to dive into the well-being aspect. And so there has been some research that suggests that veterinary well-being, such as their professional quality of life, has some sort of relation to client satisfaction, where if they feel stress, they feel like it is impacting their client care and interactions with the clients. And we know in livestock research that stock person well-being and their stress levels can actually impact the handling applied and then in turn those animal welfare outcomes. And so we were thinking, well, why would this not play a role in the veterinary field? It might. Let's explore this a little bit further, especially because we know the level of burnout and compassion fatigue that does exist in this field. So we want to see how handling is playing a role in potentially impacting these outcomes. And so the relationship between veterinary professional quality of life and handling practices were explored as well in this survey. And we did this through ProQual, essentially is the term, professional quality of life. It is a validated self-report tool that has been used in different helping professions, such as in the veterinary field, across both the US and Canada. And it basically assesses how individuals feel in relation to their helping profession, including both the positive as well as the negative. And so the positive aspect is compassion satisfaction. And this speaks to any pleasure that is being derived from being able to do their work well. And then we have compassion fatigue, which is broken up into two subcomponents, burnout and secondary traumatic stress. So burnout is feelings of physical and emotional exhaustion, being overwhelmed and ineffective. And then secondary traumatic stress is those negative feelings derived from exposure to whether it's indirect or direct work-related traumas. And so to explore this in a comprehensive way, we first looked at each of these ProQual outcomes, so compassion satisfaction, burnout, and secondary traumatic stress as predictors of using both minimal and full body restraint. And then we looked at the use of minimal and full body restraint as predictors of each of these ProQual outcomes. And so what we found was interesting was that handling practices did not influence their well-being. However, those that had low to moderate secondary traumatic stress were more likely to apply full body restraint. And so what we think is happening here is that those that had high levels of secondary traumatic stress may actually be making decisions in the moment to avoid additional stress associated with handling fearful or aggressive animals. And then for stress reducing certification, we see this as an interesting finding that if they had one, if they did the effort and did some CE and took those online modules and did the effort and knows the things, they were more likely to report moderate to high burnout. And so this was very interesting, and we had to sit with this one for a moment. But we think, because there is preliminary research starting to look at this relationship a little bit, we think it might be related to some workplace barriers in place that prevent the application of these practices. So already we know that there's time constraints, workload, difficult transactions with clients, and maybe poor patient outcomes that can impact the ability to apply these practices. So there may be some sort of moral stress. that they know what they should be doing, but there's barriers in place that prevents them from being able to do it. So it's really not about, did you get your certification, but it's about, does the environment that you work in allow you to apply these practices? And so overall, we see that these handling decisions are multifactorial. It is dependent on training, the clinic environment, time pressures in place within the clinic regarding these appointment times, their perception of risk and their previous experiences, as well as the type of staff role that they may hold and their personal well-being. However, we still don't know how this translates into everyday practice, and we still want more deeper and more richer insights into these relationships. And so the last study I'm going to be reporting on is a qualitative study that my PhD student has completed that provided some richness to this data. So we used the findings from that quantitative survey basically to generate hypotheses and inform the questions that we were going to use for these interviews with veterinarians. So we developed an interview guide that was piloted with a veterinarian and ended up being around 11 questions, only 30-minute interviews, and then we recruited from Canada and the United States. They were conducted on Zoom, they were recorded, transcribed. We got 17 veterinarians. We did some inductive content analysis, peer debriefing, which was a lot of fun. And then codes were refined and grouped to develop categories and subcategories. So broadly, what we found regarding factors affecting dog handling was dog patients, particularly their behavior. So we saw fear and aggression come up a lot in the conversations, with them influencing their handling approach, which again was not surprising. Age, size, and breed did come up, as well as health status. So health status predominantly spoke to deferring some components of the examination to the end if it was known to be suspicious, if it's suspected to be painful area or a painful procedure, it would be guided by that as well. And owner interaction. So owners were actually perceived as both beneficial and challenging. Both their preferences, their expectations, and their presence itself. And then the clinic environment came up a lot. So this involved having decision-making autonomy to either stop an appointment and reschedule an appointment, having flexible appointment times, having team buy-in and all being on board to using stress-reducing principles and all have the same type of training in applying them, as well as clinic resources. So having bigger rooms, more rooms, and actual physical space to do such things. And then prior experiences, so in their individual experiences, whether in clinic, whether professional development, unique experiences such as working through COVID, all of them impacted their handling decisions. So that came up a lot in terms of if it was a negative experience or if they found an experience such as COVID, created opportunities to be adaptive and be creative and think things through in a novel way. Then we also saw professional quality of life. So this was the mainly compassion fatigue and compassion satisfaction. And so I'll speak to these now. So for compassion fatigue, when we asked about this, most of them said that they experienced most during their early career. And if they felt that it impacted their patients, it's because they had hard time compartmentalizing. They had a hard time with work-life balance and coping with those stressful situations. And so we see participant 13 saying, I'm more inclined to just crank this out versus another day when I take more time or adjust medication. And participant 6 says, if you have more burnout or you're just not happy with your environment, it's less likely that you're going to want to do low stress or educate people. And so this really was really interesting because we did see some had some coping strategies and some that didn't, and those that didn't did feel it actually made impacts in their decisions and in their ability to carry things out in the way that they would like to. And then we see the opposite being true for compassion satisfaction. So we actually saw that all of them did have some level of compassion satisfaction being reported, and that it did help mitigate compassion fatigue. It actually helped them support a more relaxed demeanor during physical examinations. And participant 16 says, if I'm in a good mood, it can be a lot easier to just take things in stride and approach challenges calmly. Now, regarding their perceptions of actually applying stress-reducing practices. So we saw all of them valued it, which was good. However, we did see some benefits and some challenges, mainly regarding its feasibility and efficacy in practice. And so the benefits identified were ease of dog handling and safety. An individual saying that if you actually know how to apply it properly, if you're trained well, it actually does make the appointment go a lot smoother and it is easier, and they also feel a lot more safe, and it does increase their productivity in that way. And so this is a quote here that says, it can really improve the relationships that you have with the clients because they feel like their pet is being handled in a humane way. Therefore, you can do better care for the animal because the client trusts you. And then for challenges, we see a lot of lack of support and resources and decreased efficiency. So efficiency was actually a really big obstacle. It spoke to having rigid appointment times, high workloads, basically feeling that they really needed to keep up at all times with the nature and speed of the clinic. And the participant 10 says, if we're like really behind and I'm busy and I really just want to get this done, then I don't have time to, sit on the floor and feed 1 treat and then 2 treats and then 3 treats. So speaking a little bit to dynamics that are outside of their control, really making it hard to implement these practices on the daily. And so just to quickly summarize the findings across all 3 stakeholders, we see for dog patient welfare, more restriction being applied during handling was associated with more negative responses and poor welfare outcomes. For veterinary staff, we see decisions are being shaped by their environment, their education, their previous experiences, and their perception of risk during the appointment, as well as their overall well-being. And then for their client, we see that they prefer to be in the room. They prefer minimal restraint and unless their dog is aggressive. And then the clinic environment is kind of really shaping these relationships and constraining these decision makings through time pressures, workload, resources, and staff training. And of course, they don't work in isolation. So the intersection between the dog and the veterinary staff shows that decisions are guided by dog behavior and that veterinary staff are balancing the dog comfort, owner preferences, and staff safety daily. We know that the clinic environment is shaping the dog's responses, especially through the physical environment and the resources available, and then indirectly through those veterinary patient interactions. And then the clinic environment and the veterinary staff is mainly speaking to the restraints in place. So time pressures, policies, all of those things that will impact those daily decision-making. And then we have compassion fatigue playing a role as well and influencing these practices as well. So what does this mean? The implication for actual practice. We see that handling basically impacts all stakeholders, and we know that these factors are driven at both each individual level as well as clinic level. But truly, in order for us to make any change whatsoever, we need to be targeting interventions at the top, at that systems level, in order for that change to trickle down and actually allow everyone to apply these practices. Because there's truly this mismatch between what we know is good and the feasibility of applying it. And so we need that intervention at that clinic level. We need to modify appointment structures if possible, as well as having flexible appointment times, having alignment and team buy-in in sharing these values of applying these practices, and shifting from that individual approach to a shared system level solution. So I've kind of changed these circles into gears, highlighting that the clinic environment is the largest gear that needs to be driving this change. So we really can't expect to continue to make these recommendations and doing all these. I can't expect to be doing all these studies and saying this is best practice if the environment doesn't support it. And so we also need to continue to do translational research that is testing these feasible and, of course, scalable strategies so that they can be readily applied. And at that, I'd like to thank my collaborators, so Dr. Carly Moody at UC Davis and Dr. Katie Schroeder at Iowa State, and then all of my student researchers that contributed to this, all of this projects that I've explained, as well as leading the research themselves. So thank you. I'm happy to take any questions.